sounds to me like you're integrating a lot of different modalities when it comes to treating breast cancer. Yes, you're treating breast cancer, but you're treating it as a whole, mind, body, spirit. So we got to treat it. Everything works together. Tell me a little bit about how you treat it collaboratively in the Dubin Breast Center. You know, you mind, body, spirit.
Well, the first level is within the psychological services. There are 4 psychologists, and we work together to make sure that the patient's getting what they need. And we have specialists in things like hypnosis, and as we said, family therapy, couples, etc. In addition, then we kind of branch out. We work closely with the massage program.
Yoga, I heard
yoga
they have
program,
here.
yep.
They have even meditation.
And so we talk with them, and we get people into the right place they want to be. And then also, I feel, you know, that we're part of the overall treatment team. We all know the surgeons and the oncologists very well, and the radiation oncologists, and so, you know, they feel, I think, very comfortable in reaching out to us and saying, I have somebody that really might benefit from working with you. And then we know we can be there, that we can do that, and be a value add not only to the whole community at Dubin Breast Center, but to that particular patient and helping improve their quality of life.
What is the research saying about integrative medicine and how it helps patients get through whatever they've got to get through?
Well, I guess what I can say to this question is that we're living in a very exciting time, and that the research overall is becoming very positive, and that we can help patients, whether it's breast cancer patients going through those specific treatments or others, but that we can improve quality of life, and that symptoms and side effects of the cancer and its treatment don't have to be as bad, that you might be able to speed up your recovery a little bit, that you don't have to be as distressed as you go through the different steps. And that then there's also future horizons that we start thinking about how things like massage may interact with the healing process, how things like yoga, meditation, and we talked about hypnosis, how all these things may be able to get a person back to where they want to be a little more quickly. And so overall...
Have there been studies showing that?
Yeah. There's been studies, our studies here have shown that just in a very controlled setting, that patients spend less time in the operating room when they get an intervention before they go into surgery.
Is it less money on insurance?
Our research has shown that it's not necessarily insurance, but if we look at the costs from an institutional perspective, that a patient in our treatment group costs the institution about $772 less than a patient in the control group within the same randomized clinical trial. And so I think this is part of the hope going forward for this whole integrative area.
It's an investment, really.
Right, when we show the cost savings, that hey, if we do these very, essentially simple procedures with patients to help them feel better, it can have almost a snowball effect.
Right.
As the patient starts feeling better, things can be set in motion to go better over a longer trajectory.
Do you also feel that with the families that are coming with the patient, I would think that they would need your services in a way. You said that you deal with the families because they're so worried about the patient. If they're worried, they're going to stress the patient out. So what kind of work do you do with them?
We do a lot of different work with them, and we're very fortunate to have Dr. Maria Nevis here with us, who specializes in this area. And it's everything from, how do I tell my child I have cancer? Even that very beginning process, to then, how do I cope with trying to keep up with all the duties, for example, of being a mom, but also going through cancer treatment, for treatment for breast cancer, and all those pieces of it and how they fit together, and then the fears that are experienced by children depending upon their developmental level. It's obviously earth-shattering. Their parents, their mothers, their world, and to say there's a threat to that. And so how can we work together to bring everybody together on the same page and continue to provide that secure environment for the whole family?
It's amazing. For people out there that are watching, if you were to give any advice to a family going through this, so either a mother's diagnosed with breast cancer, what advice would you give the whole family? I mean, it might be too broad, but is there anything any special advice you'd give them?
I think the first step, whether it's a friend or a family member, is continue to be that person. Continue to be that loving family member, that loving friend, and provide the support that your patient, let's say, is going to need. And being there for them, both physically and emotionally, and letting them know that. The thing I would avoid a little bit is predicting the future, because we all want to be reassuring and being able to help our friends and family members, but we have to see how this goes. We don't want to make bold statements and predictions when we don't know yet. We don't want to essentially promise too much. Let's take this instead, I guess I would recommend, is one step at a time, and say, yes, I know that tomorrow you have your chemotherapy appointment, and I'm coming with you, and I'm going to be there for you because I love you. But then saying, we'll see, and then after that, we'll see what comes next.
Right.
And know that I'll be with you every step of the way.
Oh, that's beautiful. All right. Thank you so much, Dr. Montgomery, for talking to us today and taking us through that very special hypnosis. It was it was amazing, actually. So, and I hope you continue to do the wonderful work you're doing here at the Dubin Breast Centre.
Oh, thank you so much, and thank you so much for letting me speak with you today.
Thank you.